Retinal diseases are conditions that affect the retina, the part of the eye responsible for sensing light and transmitting visual signal to the brain. Common retinal diseases include glaucoma, age-related macular degeneration (AMD), and diabetic retinopathy. If not treated early, these conditions can result in permanent vision loss and even blindness. Once damage to the retina occurs, it is often challenging to reverse. Therefore, early detection and treatments are crucial to preventing severe outcome and preserving vision. Glaucoma and AMD are common eye diseases, particularly among older population. The first line of treatment for glaucoma typically involves topical eye drops. These medications work by lowering eye pressure to prevent further damage to the retina and optic nerve. Common examples include beta blocker, prostaglandin analogs, and alpha agonists. In the case of AMD, treatment aims to slow disease progression and manage symptoms. For the more prevalent dry form of AMD, there is currently no FDA-approved treatment. However, for the more severe form of wet AMD, anti-VEGF injections are commonly used to inhibit abnormal growth of blood vessels in the retina. Until now, there has been no effective cure for glaucoma. While medications can effectively slow the progression of the disease, they come with certain limitations and unwanted side effects, such as irritation or itching, allergic reactions, and contraindication, especially for patients who have heart or lung condition. For wet AMD, traditional treatment typically involves frequent injection of the anti-VEGF into the eye. This not only increases the risk of infection, but also places a significant burden on patients. In addition, these medications may result in drug resistance over time, limiting their long-term effectiveness and affecting patients' compliance. Our technology offers a promising solution for targeted drug delivery and improving drug efficacy.
Biomimetic Nanoplatform technology is an innovative approach in nanomedicine. It draws inspiration from natural biological processes to design nanoparticles that mimic the function of living cells. This technology focuses on creating nanoscale systems that imitate the structure, behavior, and the interaction of biological entities, such as cell membranes, proteins, and receptors. Cell membrane-based nanotherapeutics represent an exciting advancement in nanomedicine, where nanoparticles are coated with natural cell membranes, such as those derived from immune cells or stem cells. These coatings enable the nanoparticles to replicate the biological function and the properties of living cells. Think of them as disguised couriers that can invade the body's defense system while delivering medicine directly to targeted tissues. Inflammation is a key driver of retinal diseases. Chronic inflammation damages retinal cells, potentially leading to vision loss or even blindness. Macroglia are natural immune cells in the retina, acting as sensors and responders to injury and inflammation. Macroglia membrane-coated nanoparticles mimic the natural behavior of macroglia. They use the inherent detecting ability of macroglia to detect inflammation in the retina. These nanoparticles deliver potent drugs that help prevent damage and protect vision. The membrane coating contains proteins and receptors from macroglia, allowing them to recognize inflammatory signals, such as elevated cytokines in the retina. Once these nanoparticles reach inflamed areas, they release the encapsulated drug quickly. This natural flavonoid compound demonstrates potent anti-inflammatory properties and exert neuroprotective effects, through multiple molecular mechanisms. There are advantages by using Biomimetics Nanoplatform. First, it's like giving drugs a GPS to reach the target site. By engineering nanoparticles coated with natural cell membranes, such as microglia cell membrane, our platform mimics biological process to actively seek out inflamed or diseased retinal tissues. This biomimetic design ensures that drugs accumulate precisely where needed, maximizing therapeutic impact while sparing healthy cells. As a result, it is both safer and more effective. Second, it enhances drug stability and sustained action. Many promising agents, such as cyclin, nucleic acid, and peptides, facing hurdles like poor solubility, rapid degradation, or limited penetration. Our nanocarrier acts as a protective shield, safeguarding encapsulated drugs from degradation and enabling controlled, prolonged release. For example, we have extended cyclin's half-life in the vitreous to twice that of free drug formulations, significantly boosting its efficacy. Finally, it is customizable, allowing for tailored treatment that fits each patient. One-size-fits-all approach do not work for everyone, as diseases progress differently and patients respond uniquely. Our platform's modular design allows for customization. Membrane coatings can be tailored to target specific biomarkers, and the drug payload can be adjusted based on disease stage or patient profiles. This flexibility paves the way for personalized treatment strategies, which represent a critical advance in managing complex retinal conditions. By integrating targeted delivery, enhanced drug performance, and customizable design, we are advancing toward therapies that are not only effective but also safer and more patient-centric.
Currently, there is no effective disease-modifying treatment for retinal disease such as glaucoma. This invention has the potential to revolutionize future treatment by utilizing a biomimetics nanoplatform coupled with neuroprotective drugs. Our future plan focuses on further optimization, refining the nanoplatform design to enhance the efficiency and stability before conducting clinical trials. We also aim to expand this platform to other retinal diseases.